Okay, we are back, Senate Health and Welfare, and February 3rd, hard to believe. So we're now going to be taking up S-243, and we have Ledge Council in with us. And Jen, do you want to introduce Tommy or?
Sure. We have with us today, and I'll let her introduce herself as well, but Tommy Mandel is a law student at Vermont Law School and is serving as a student clinician with the Office of Legislative Counsel during the session, and she will be doing the walkthrough today.
Tommy, welcome. We're very happy that you're here, and we look forward to having you work with us. So why don't you introduce yourself a little bit, say who you are, and then we'll listen to you, get an understanding of what's in S-243. I'm not going to introduce it as sponsor, but I'll just let you take it.
Thank you. Hello, my name is Tommy Mandel. I'm a 2L at Vermont Law School, and today I was asked to walk through S-243, an act relating to an unused prescription drug repository program. So Section 1 of the act asks the Agency of Human Services to consult with the Board of Pharmacy, Board of Medical Practice, and make reasonable efforts to consult with representatives from Vermont pharmacies, hospitals, long-term care facilities, and other healthcare facilities to evaluate the feasibility of implementing an unused prescription drug repository program. And the program would accept and dispense donated prescription drugs and supplies to Vermont residents who meet specific eligibility standards.
Tommy, I'm sorry to interrupt. I wonder if committee, would it be helpful to have the language up on screen share? Why don't we do that? I apologize for interrupting the flow there, but why don't, if you can screen share and put it up, that would be good. And I probably should say, by way of introduction, that this bill was one that we did look at a program. We looked at the whole program a few years ago, but we decided that it was a big undertaking for the time and put the program off. So now we have this bill introduced, which is slightly different. So Tommy, it's all yours.
Thank you. So in determining the feasibility of the unused prescription drug repository program, the bill asks the Agency of Human Services to consider the potential benefits of the program to Vermont consumers, the healthcare system, the environment, and the state, implementation and administration costs, including contractual agreement with a third party, one or more funding sources to support the program, to evaluate and consider the criteria under which the pharmacies, hospitals, long-term care facilities, other healthcare facilities would accept and dispense donated prescription drugs and supplies. These criteria include eligibility criteria for participation by the pharmacies, hospitals, long-term care facilities, and other healthcare facilities, the standards and procedures for accepting, safely storing, and dispensing donated prescription drugs and supplies, the standards and procedures for inspecting donated prescription drugs and supplies to determine if the drugs are in their original sealed and tamper-evident packaging, and to ensure that the prescription drugs and supplies are not adulterated, misbranded, or otherwise unsafe. It also asks the agency to consider eligibility criteria for individuals to receive the donated prescription drugs and supplies as a part of the program, the fees that a pharmacy, hospital, long-term care facility, or other healthcare facility would be allowed to charge for accepting, distributing, and dispensing the donated prescription drugs and supplies, the types of prescription drugs and supplies that the program would accept, and to consider an outreach and education plan to inform the public of the availability of the program, including who may be eligible to receive donated prescription drugs and supplies under the program, how to demonstrate eligibility, and whether individuals may donate prescription drugs and supplies, and if so, how to donate them. The bill further asks the Agency of Human Services to provide the House Committees on Healthcare and Human Services and the Senate Committee on Healthcare, Health and Welfare its analysis on or before January 15th, 2023, and recommendations regarding the program's implementation in Vermont. And the second section of the bill says it will take effect on passage.
I was muted. Thank you. That's clear. So in committee questions for Tommy at this point? I guess I would have a question, and that is, as you're looking through the bill and thinking about what this program might look like, could you give us more of a general description of what we're seeing in the bill?
I believe that the bill asks the Agency of Human Services to consider the aspects of the program, but other than that, I would defer that question to Jen.
Okay.
Sure.
Can you give us a thumbnail?
Legislative Counsel. Sure. I think that the thumbnail is just that this would be directing a study to look at what it would look like to create an unused prescription drug repository program in the state and report back on what that might look like.
And I believe that the Department of Health is very supportive of doing this study at this time. I mean, the last time we looked at having a program, there was not a lot of enthusiasm because of the expense and the time. So we'll bring the Department of Health in to talk about this. The other thing, and Senator Hardy couldn't stay with the committee meeting this morning, but she did bring up that the free clinic that is in Addison County under, I think it's Steve Meyer, mayor, does have some kind of unused drug program. So we might invite them in, or I think it would be important to ask them if there's something that they might add into the conversation when the study goes forward. We'll put them in for testimony. Questions, committee. Senator Hooker.
Thank you, Senator. Just a comment, I just read an article about expiration dates on drugs, and it'd be interesting to have someone come in and comment on that so that people would feel secure in knowing that if these drugs are donated, they may have the potency that's necessary to continue their effectiveness. So that's just something that I think enters into this.
That probably would be, is there anything in the bill, Tommy, that suggests review of expiration date or currency of the prescription?
The bill asks the Agency of Human Services to determine and consider eligibility criteria for participations and standards and procedures for accepting the prescription drugs and supplies, and also it asks the Agency of Human Services to determine standards and to consider standards and procedures for inspecting the prescription drugs and supplies to ensure they are not adulterated, misbranded, or otherwise unsafe for dispensing. So it might fall under that category.
Okay, right. Well, good. Yeah, that's helpful. When we bring, I think it says AHS, but I think I don't know whether it will involve DEVA as well as Department of Health, but we'll bring Department of Health in, and then we'll see if anyone else in AHS would like to comment on the bill. Good question, Senator. Any other questions about the bill or potentially the program? Okay, good. So Aaron reminded me, we do have David Englander, the Department of Health, coming in next week on this bill, so that'll be helpful.
And there is the report, excuse me, when this language was passed in 2018, there was a report that came from that Tommy can make available, I think has provided to Aaron, if that would be helpful for people to see. This would ask for the same study to be done again. I think that was at the request of the stakeholders, so they're interested in revisiting this issue.
Okay, do we have that report then?
I do have it. I can put it up if you'd like.
Yeah, why don't we put it under 243 until we finish with 243? Let's do that.
Okay.
Okay. What is the state that currently has this? Is it Iowa who worked through and put a big program in place? Jen, do you remember?
Iowa is one of them. I think Tommy had done some research through NCSL and may be able to tell you more about which states or how many states have programs.
Can you do that, Tommy?
Yes, NCSL said that as of fall of 2021, 40 states, Guam and Washington, D.C., passed legislation establishing prescription drug repository programs. However, 27 states in Washington, D.C. have operational programs. 13.
Oh, I got it. Okay.
Yes, 13 states and Guam have laws enacted, but no operational programs.
Are there any states around us that are operational?
New Hampshire.
New Hampshire has one. Wow. Okay. Does it have information about costs, startup costs or anything there?
I'm unsure. I can look into that and get
Okay.
information back to you.
Yeah, and we may hear from the Department of Health as well, so that'd be good.
And there is information in the 2018 report about their estimates based on the Iowa program that it would cost Vermont a little under $240,000.
Okay, I remember that.
Approximately, if we were to contract with that same company.
Okay. Senator Cummings.
No, these are collection for reuse, right? Not just collection. Okay.
Right. It's not disposal, it's reuse.
Right. So now we have a disposal program in place.
Yeah.
But we don't, except for what we understand happens at the free clinics, apparently, we don't have a reuse program. Okay. Okay, so now Aaron's put the report up under Sheila Livingston's name on our webpage. So that's a 2018 report. We can look at that. Is there interest? I guess the question is, we know we can invite people in and look further at the bill. Is there interest in doing that from the committee? And I just went ahead and invited Department of Health in because I thought it might be worthwhile looking at, but I'm open to taking it down. It's up to the committee. Anybody? Senator Cummings.
No, I was here when we did it last time. I actually thought we voted it out.
I did too. I guess we. Oh, wait,
You
Jen,
did. You voted.
Yeah.
You voted out the study.
Yeah.
And they came back with the study, but you didn't do the next step
Vote
of
out.
actually.
Okay. Okay.
So really, this is an update of what happened in the 2018 report. We'll have to look at that. Okay. Senator Hooker, Senator Terenzini.
No, I think from what I've read just recently and tangentially, there are savings to be had from this. So if there are savings to be had, I'm all for it.
Yeah. Yes.
Whatever Cheryl just said.
It's nice to see
Ditto.
a county hold together.
We're all on the same page. Okay, this will be great. Is there anything else, Tommy, that you had that you'd like to present to us on the bill in the research that you've done?
Okay.
I have the NCSL webpage. I can also share with Aaron if the committee wants access to that. It shows all the different states' statutes regarding these programs,
Oh, good.
shows how many patients other states have served, redistributed however many dollars of medication and supplies. So I can share that with Aaron.
That would be terrific. So that will demonstrate the savings that Senator Hooker is very concerned about. We're all concerned about, but that's good. And then, so the question is, what in your work, have the state programs charged for reissuing the drugs? Do they receive money for reissuing the drugs, or are they sent out free? Do you have any of that? Is that available?
I am unsure. I can look into that and let the committee know what I find.
Yeah, no, hold on to it. And then when we take the bill up again, we'll hear from you on that and maybe some of the other things that you identify. Okay. Yeah, I mean, there's an administrative fee to putting, it would seem to me, we're going to hear there's an administrative fee to setting this thing up, but then how they're distributed through in what way, that's a question. Okay. There must be some information in the report about that 2018. I don't remember. Okay. Any other questions? Comments? Senator Hooker, do you have articles relating to this that you might want to have posted?
I can look to see where I found that. I think it just came across on the internet, actually. And
Oh, we love the internet.
look it up. Thank you.
Yeah. So that would be great. I mean, we could, if you send it to Aaron, he'll post it under your name and we'll have it. The other question I have for folks is, we have a couple other bills on prescription drugs. One is a bill recommended by the Green Mountain Care Board. I think Robin Lunge, I met with her on that. And then the other one is the brown bag, white bag bill that can sound confusing, but it's also a prescription drug bill. And I'm thinking we may want to pick those two up going forward. So we've got, we'll consolidate. We'll try and look and see what we have for prescription drugs and work on that. I forget the numbers of those bills. Senator Hooker.
That being said, we also have a bill on PBMs, which will enter into.
Yes, and it's, unless I hear differently, the House is starting on that. And I have another meeting with Representative Lippert today, and I will verify that the House is taking that bill up, because if they're not, it's a bill that I think we're all interested in taking up. And if they're not going to do it, we'll add that to our prescription drug list.
Okay.
Yes, I know you're very interested in that. I get it. Senator Cummings.
Yeah, you and I have a bill in working on the long wait lists and the hospital regulations.
Yes,
which might be a good one to take a look at.
we will.
Mm-hmm.
That is also on the list. There's a lot there. Okay. So those are the prescription drug things. I don't know when we will get to those. We've got, we'll talk tomorrow about what we're doing next week a little bit, some of the continuation of our work. So, any other questions for Tommy? Jen? Tommy, thank you so much. And your research is very helpful. So as we go through the bill, I hope that you'll be with us again. Good. And your webpage that you sent in to Aaron is now posted. I think it's under your name, so that's good. All right. You know what? We have some time, so I'm going to give you a gift of time. We'll end the meeting at this point. And thank you all